So new numbers just released show how dangerous the flu can be for children and infants. But in this crazy year with COVID, what happens when the coronavirus collides with the flu season?
Our Brianna Whitney talked with a local doctor and a mom who had a horrifying experience when her child came down with the flu. She joins us live in Scottsdale tonight. Brianna.
Yeah, Nicole, this past flu season just ended in late September, so doctors are gearing up for the winter when when flu cases usually spike. But a pediatrician says even though this last season was the deadliest flu season for kids, he says this season it might be hard for parents to tell what's COVID and what's the flu, and especially terrifying for parents who have to experience the worst of it.
So it was a really scary situation for us.
This is 4-year-old Asher now, happy as can be. But in 2019, after already having compromised lungs, the flu took over his little body.
Within 20 minutes, he had a 98 temperature, normal to 102, and we're calling the ambulance. The EMTs had to administer oxygen for him to keep him breathing and help him recover.
Asher's mom, BREANN, says severe pediatric flu can be so devastating. And this past year, a record-breaking season for pediatric flu deaths in the United States, with 189 kids passing away from September of 2019 to September of 2020, according to the CDC. In Arizona, the state health department says we had 5 pediatric flu deaths this past season compared to 0 the season before.
It seems that the severity of that flu virus this past year was a little bit stronger, more severe than past cases, past years.
Dr. Salil Pradhan is a pediatrician at Valleywise Hospital in Phoenix and says he often sees similar symptoms in kids who have a severe flu.
It's a typical cough, cold, congestion, certainly the progression to pneumonia where they have a lot more difficulty breathing. One of the more interesting things really is the muscle aches that you get with influenza, and a lot of times in the legs especially.
He says kids who end up dying from the flu generally develop either viral or bacterial pneumonia with it. But he says this season is about to be a whole new beast.
COVID, unfortunately, has had the high fevers that flu has had as well. And so I don't know that parents really are going to be able to tell the difference just based on the symptoms that their kids are showing.
Both BREANN and Dr. Pradhan say parents need to act right away, especially during the pandemic.
Even a low-grade fever to something to watch.
Calling their pediatrician, coming to the emergency department and having them have their kids tested is really going to be the most important thing.
Now, Dr. Pradhan says more often than not, kids will have the flu over COVID, but he says it's important to test for that right away so they can get you the right treatment. For example, if kids have the flu, they can give them Tamiflu within the first 48 hours of symptoms coming onto them. Reporting live in Scottsdale tonight, Brianna Whitney for Arizona's Family.